Come in.
Hello, my name is Lakeisha, and I am your student nurse for today. Will that be okay?
Yes.
All right. A few questions that I need to ask before we begin. Can you give me your full name and your date of birth?
Kyla Ollie, 09/27/2000.
All right. Can you tell me who the president is?
Joe Biden.
And what year is it?
2023.
All right, Miss Kyla. Can you tell me what brought you into the clinic on today?
I'm having dull stomach pains.
How long would you say that you've been having these stomach pains?
On and off about a month.
Okay. When you have the pain, when you eat, does the pain get better or does it get worse?
Better.
All right. I see in your chart, just looking back over your history before coming in, that you've been diagnosed with peripheral artery disease. Is that correct?
Yes.
All right. If it's okay with you, we'll do a little assessment on today. Just to start it off, I will wash my hands before the procedures. I will wear gloves when needed. A stethoscope will be used, so you may feel this on your skin, as well as to feel the palm of my hand on your skin as well. If at any time you have any pain or discomfort, let me know. Sounds good?
Yes, ma'am.
All right. You mentioned about the peripheral artery disease. So what I would like to do is to assess your upper and lower extremities. Pretty much just looking at you from the front facing anterior. Everything is symmetrical. Your skin has good skin tone, even tone. I don't see any rashes or lesions. Is it okay if I put my hands on you?
Yes.
All right. With palpating your skin is noted to be warm and dry. As I said before, good skin tone. Looking at your hands, no clubbing of your fingers. What I'll go ahead and do is check your capillary refill. That's simply just pressing your nail bed to see how quickly they feel, and it's less than 3 to 5 seconds. Just turn your arm over. I can go ahead and assess your brachial pulses here, your radial pulse here. Can you please squeeze my 2 fingers as hard as you can? All right, very good. I want you to use your hand and push up against mine. That's just to test your upper body strength. Also, see if you can pull away from me. Pull back. There we go. All right. What we want to do now is I'm going to get you to stand up briefly for me, because the scenario had an 83-year-old female. So one way to test an 83-year-old if they may have had a CVA in the past, what I want you to do is hold your arm straight out in front of you with your eyes closed for a few seconds. If there was any abnormality, there could have been a possible drift in the arm, unbalance, but we do not see that here. So thank you. If you can sit back on the bed for me. What we'll do now is check your lower extremity. So what I want you to do is to lay flat on your back. Also, what I brought here also is just a Q-tip swab and an instrument that I would use to test your Babinski reflex. I'm just going to pull your pants up just a little bit just to see your thigh area. All right. Looking at your legs bilaterally, good skin tone, good color, no rashes or lesions. Got to put my hands and just touch your skin. Your skin is warm to dry. Looking at your lower extremities, your hair on your leg is evenly distributed. No shining to the skin, so that lets me know that you do have adequate blood supply to your lower extremities. Looking at your joint area, I detect no edema or swelling. Is there any pain to your knees or your ankle area? All right. At your lower extremities, I could go ahead, could bend your legs for me. Behind your knee, go ahead and check for your popliteal pulses. And with your pulses in your arm, your brachial and your radial and your popliteal, they both are all 2+ bilateral. I can go ahead and check your posterior tibia as well as 2+ bilateral. And I can go ahead and check with my gloves. I would put gloves on at this point and check your dorsal pedis pulses. And they both are 2+. Just looking at your capillary refill on your nail bed, pink in color. Refill noted 3 to 5 seconds. What I want you to do is push against my hand to test your strength. I want you to try to raise your legs and push against me. Raise your legs up. Very good. At this point, that will end our evaluation of our upper and lower extremities. Because of the peripheral vascular disease, you have good skin color, even distributed hair on your arm as well, and your lower legs, normal pulses in your extremities. The extremities were warm to touch, no pain, no swelling. I can also check your movement of your joint, no crepitus or popping notice in your joint area in both of your arms. All right. And that will conclude the upper and lower extremity. Now what we want to do, because you complained of abdominal dull pain on and off for about a month, what we'll do now is assess your abdomen area. Okay. And we're just gonna tuck a little tank top under your bra as much as possible. And then I'll use this towel just to drape you for privacy. All right, when assessing the abdomen, initially we want to inspect, or just look at your skin color, kind of bend down and look across to see if it's evenly as no with your contour, so there is no distension. Everything seems to be flat. What I would do now is, the first thing is go ahead and auscultate your bowel sounds, and we will start at the right lower quadrant. If I do not detect any bowel sounds, I will have to listen for 5 minutes. Move up to your right upper quadrant, your left upper quadrant, and your left lower quadrant. Because we're already auscultating your bowel sounds, at this point I can go ahead and listen to your valves with my bell if I had the right stethoscope. But your valves would be, first one we would listen to above your navel would be your aorta valve, and no bruits or thrills. The next we will listen to is your right renal artery. The next one would be your left renal artery, your left iliac, and your right iliac. We would also check your femoral pulses, but because of privacy, which they are located in your groin area, we will not check those on today. At this point, we've auscultated or listened to your bowel sounds and your valve sound. Now we will go ahead and do a soft palpate clockwise, starting in the right lower quadrant. And I'll just palpate with my hand very softly. Let me know if you have any pain. What I'm checking for is for any mass, any tenderness, any pain or discomfort. All right. That would be a soft palpate. Then to go anywhere no more than about 4 centimeters, then I can use 2 hands and start with the right lower quadrant, moving up, and do a deep palpate. All right, any pain there?
No, ma'am.
One question that I did forget to ask you, when was your last bowel movement?
Today.
All right, and when was your last menstrual cycle?
The 30th of last month.
Okay, any burning or stinging when you urinate?
No, ma'am.
All right, our initial scenario was an 83-year-old that was brought in, skilled nursing visit, that complained of abdominal pain, that improved when eating. One thing that we can evaluate her for, as for the abdomen, we had positive bowel sounds on all 4 quadrants. No bruits or thrills were noted when listening to her valves. We could evaluate for possible peptic ulcer disease. We could look at her medications on that. She complained of, in the scenario, a decreased sensation to her lower extremities, and which I did forget. So what I want you to do is to close your eyes. I'm going to use a soft little cotton tip. And I want you to tell me which leg that I'm touching with the cotton tip, okay?
Okay.
All right.
Right. Left.
And you can tell me upper or lower leg.
Okay. Upper right. Upper left. Lower right.
What am I touching?
Your foot. My foot. Left foot. Lower. Bottom of my left foot. Bottom of my right foot.
All right, and another test that I could do also is the Babinski reflex test. All right. All right. Well, pretty much what we could do is look at what medications we would prescribe. Could possibly treat her for peptic ulcer disease because it is noted that pain will improve when eating. We have good circulation in our upper extremities and lower extremities. Good muscle strength and muscle tone. That completes our upper and lower extremity as well as our abdominal test. Are there any questions for me?
No, ma'am.
All right. Continue to take your aspirin, and we'll go from there.
Okay.
Thank you.